Hello, I'm Dr. Michael Bennett. I'm a urologist and a professor of medicine with over 30 years of experience helping men, especially those in their 60s, 70s, and beyond, stay strong, vital, and sexually confident. Most men understand that their heart ages, their brain, their bones. Sure, those too. But the penis? That's the one organ most of us never think about until it stops working the way we remember. And by that point, it often feels like something has quietly slipped away. Performance, yes, but also confidence, pride, and in many cases, connection. Here's the truth no one told you. Your penis ages just like the rest of you, and it needs care, not shame, not silence. Most importantly, what men experience after 60 is usually not about age. It's about neglect. That's right. The decline isn't inevitable. It's preventable. And in many cases, reversible. So in this video, I'm going to walk you through 7 practical, science-backed ways to care for your penis and protect your vitality. And I'll also share one bonus tip that most doctors forget to mention, but it could make all the difference. Some of these steps are simple, some might surprise you, but every one of them is based on what I've seen work, time and time again, in my clinic. Before we dive in, let me ask you this. When was the last time you truly checked in with this part of your body? Not out of fear or frustration, but out of respect. If that question made you pause, then you're in the right place. Because taking care of your sexual health isn't about chasing youth. It's about honoring the body that's carried you this far and making sure it keeps working for you with strength, clarity, and dignity. If that resonates with you, go ahead and hit subscribe. And if there's something you'd like to ask, or even challenge, drop it in the comments. I read them all. Let's get started. You deserve to feel strong, capable, and connected, no matter your age. Let me ask you something personal, but important. When was the last time you thought of your penis as a part of your body that needs regular exercise? Not just for pleasure, but for preservation? Here's the truth most men never hear. Your penis is like a muscle. It thrives on regular use, and it deteriorates with neglect. And after age 60, that disuse can quietly start to take its toll. In medicine, we call it penile disuse atrophy. Sounds clinical, but the meaning is simple. When the penis isn't stimulated regularly through sexual activity, erections, or even gentle arousal, it starts to lose elasticity, blood flow, and tissue health. Over time, this can lead to reduced sensitivity, weaker erections, and even shrinkage. Now I've had men in their late 60s, even 70s, sit across from me and say, "Well, I guess my sex life is over." And I always tell them, no, it doesn't have to be. That belief that sex naturally dies with age is not just false, it can be harmful. Why? Because believing it leads to giving up. And when you give up, your body follows. The good news? You can stop this decline. And you can start today. Even if intercourse isn't possible, or isn't part of your life right now. There are still powerful ways to keep this part of your body healthy. Masturbation, gentle stimulation, medically approved vacuum erection devices, pelvic floor exercises. They all help keep blood flowing, oxygen levels up, and tissues responsive. Think of it like stretching a joint to keep it from stiffening. You're not just preserving physical function, you're also protecting your confidence and identity. Because for many men, sexual vitality is about more than performance. It's about connection. It's about feeling like yourself. You don't need to perform like you're 25. That's not the point. The goal is to stay engaged, connected, and healthy. As the man you are now, with wisdom, strength, and experience behind you. So take this as your reminder. Don't go idle. Your body is still listening, and it responds to care, no matter how old you are. Let's talk about something that sounds simple, but could be one of the most overlooked parts of male self-care, especially after 60, penile hygiene. Now I know what you might be thinking. Come on, I've been washing myself for decades. I don't need a lesson on soap and water. But here's the truth. What worked when you were 30 isn't always enough at 65. Why? Because as we age, our skin becomes thinner, more sensitive, and our immune system slows down. That means we're more prone to irritation, infection, and slower healing. Over the years, I've treated too many men, good, intelligent men, who came into my clinic with issues that could have been avoided with a simple change in their hygiene routine. I'm talking about redness, itching, foul odors, recurring infections, and in more serious cases, conditions that increase their risk for penile cancer. Yes, penile cancer. It's rare, but not rare enough. Countries like Brazil have some of the highest rates, and poor hygiene, especially among uncircumcised men, is the #1 cause. If you haven't been circumcised, it's essential to gently pull back the foreskin when washing. Use warm water and a mild fragrance-free soap. Rinse thoroughly. And perhaps most importantly, dry the area completely. Moisture in skin folds can become a breeding ground for bacteria and yeast. And don't forget to wash after sexual activity. Fluids, lubricants, and sweat can throw off the balance of good bacteria on your skin, creating a perfect environment for irritation or infection. But beyond preventing disease, good hygiene also does something powerful emotionally. It gives you back a sense of control. When you treat your body with care, you feel cleaner, more confident, more connected to yourself as a man. In a world that often tells older men to quietly fade away, caring for your body is a quiet act of resistance, a reminder that you still matter. In the next part, we'll discuss a physical mistake many men don't even realize they're making, one that can silently cause long-term damage. But first, if this message spoke to you, hit that subscribe button so you don't miss what's next. Let's talk about something that almost no one warns you about, but I've seen it cause some of the most painful consequences in my 30 years as a urologist. It's the habit of engaging in sexual activity before you're fully erect. I know it doesn't sound like a big deal. You're in the mood, the moment feels right, and maybe you figure, it'll get there. But here's the problem. Your penis isn't designed to handle pressure unless it's fully supported. Structurally, the penis is made up of spongy tissue, smooth muscle, and delicate blood vessels. When it's only partially erect, it doesn't have the firmness needed to withstand the physical demands of intercourse. And when pressure is applied too early, during penetration or even aggressive foreplay, it can create what we call microtrauma. These tiny, often painless internal injuries build up over time. They leave behind scar tissue, which can harden and contract. Eventually, this can lead to a condition called Peyronie's disease, a painful curvature of the penis that can make sex difficult or even impossible. Here's the hard part. Most men don't realize what's happening until it's too late. They feel a change, maybe some discomfort or odd bending, but they wait. And by the time they bring it up, conservative treatment is no longer effective. So let me say it clearly, don't rush. Wait until you're fully erect before penetration. Use lubricant to reduce friction. Take your time with foreplay. Fecally. And if you're using medication or devices to support erections, give them time to work fully before proceeding. If you ever feel pressure to hurry up, either from yourself or your partner, pause, talk. Real intimacy comes from respect, not speed. And remember, protecting your body now could spare you years of pain and frustration later. This isn't about fragility, it's about wisdom. Knowing your body, respecting its limits, and choosing patience over pressure. In the next segment, we'll look at a habit many older men turn to in private, but one that may silently be stealing your desire and your ability to connect. I want to speak to you now, man to man. This next topic is sensitive, but it's one I believe we need to talk about honestly. Porn. We live in an age where access to adult content is instant and unlimited. For many older men, especially those who are single, widowed, or simply feeling disconnected, it can feel like a harmless way to stay in touch with desire, a little relief, a little escape. Nothing wrong with that, right? Well, not exactly. Over the years, I've seen how something that starts out as occasional can slowly reshape the way your brain responds to arousal. You see, porn is highly stimulating, fast, visual, intense, and when used regularly, it trains your brain to need that level of stimulation to become aroused. We call this process desensitization. The result? When you're with a real partner, someone you care about, someone who touches you gently, slowly, your body doesn't respond the way you expect, and it's confusing. You still feel desire in your mind, but your body doesn't follow. You start to think something's broken, but it's not. What's changed isn't your body, it's your wiring. And beyond that, overuse of porn can lead to shame, secrecy, and even isolation. It becomes a private habit that replaces emotional closeness. Over time, it chips away at confidence, intimacy, and your sense of being connected. Not just sexually, but as a man. I'm not here to judge. I'm here to encourage you. Use it sparingly, if at all. And more importantly, rebuild your natural pathways to arousal. That could mean more foreplay, eye contact, talking openly with a partner, using your imagination, or cherished memories. It might feel slower, but it's deeper, more human. Pleasure doesn't have to vanish with age, but how you relate to it may need to evolve. Let's stop chasing intensity and start reclaiming intimacy. In the next part, we'll explore one of the most underrated yet powerful drivers of sexual health: how you live every day. If I had to choose just one truth I've learned after decades of working with men over 60, it would be this: your lifestyle, what you do every single day, has more power over your sexual health than any pill ever will. Now don't get me wrong, I'm not here to bash medication. Sometimes it's necessary, and it absolutely has its place. But too often, I meet men who walk into my office with hope in a bottle. They want the magic fix, something fast to restore what they feel they've lost. And while I completely understand that desire, here's the truth: no prescription can replace the power of consistent, healthy habits. Let's break this down. Erections are all about blood flow, and blood flow depends on your cardiovascular system. If your heart and blood vessels aren't working well, neither will your penis. That's why things like smoking, poor diet, heavy drinking, or skipping physical activity can slowly choke off your sexual vitality. In fact, did you know that erectile dysfunction is often an early warning sign of heart disease? Sometimes, your penis is whispering what your heart hasn't said yet. But here's the good news: your body is always listening, and it responds quickly when you treat it well. When you quit smoking, circulation improves within days. When you eat leafy greens, berries, and healthy fats like salmon or olive oil, your blood vessels thank you. When you walk 30 minutes a day, get restful sleep, and reduce alcohol, your hormones rebalance naturally. And when that happens, your confidence returns. Your energy rises, your performance improves, gradually but meaningfully. I've seen men in their late 60s and 70s make small, daily changes that transform their entire experience of aging. Not just sexually, but emotionally and mentally too. So before you reach for another prescription, ask yourself, what can I do today to support my body from the inside out? Start small. Drink more water. Take the stairs. Turn off screens before bed. Each step is a vote for your vitality. And if this message resonates with you, go ahead and click that subscribe button. You don't want to miss what's coming next in this powerful series on reclaiming your energy, your confidence, and your connection. Let's keep going, together. If there's one group of muscles most men never think about, but absolutely should, it's the pelvic floor. It's not flashy. You can't see it in the mirror. But this invisible muscle group plays a major role in two things most men care deeply about: bladder control and sexual performance. Let me ask you, have you ever had trouble holding your urine? Or noticed weaker erections than you used to? You might think that's just age catching up. But often, it's a weak pelvic floor sending out distress signals. Your pelvic floor is a sling of muscles that supports your bladder, bowel, and yes, your penis. When strong and active, it helps you maintain erections, delay ejaculation, and control urination. When it's weak, you might notice leaks, softer erections, or even feelings of disconnect during intimacy. Here's the good news: it's never too late to train this vital group of muscles. The best part? You don't need a gym. You don't even need to leave your chair. Let me introduce you to the Kegel exercise for men. It's simple, but powerful. First, tighten the muscles you'd use to stop urinating midstream. Hold for 5 seconds. Breathe, then release for 5 seconds. That's one representative. Aim for 10 to 15 reps, 2 or 3 times a day. You can do them while watching TV, sitting in traffic, or waiting for your coffee to brew. At first, it may feel a little strange. After all, no one talks about training these muscles, but the results speak volumes. I've had patients in their 70s tell me it was a game changer for their confidence and control. Think of it this way. You wouldn't ignore your arms or legs if they started to weaken. Why ignore the very foundation of your sexual function? So here's your quiet mission. Start training the muscle no one sees, but everyone feels the benefit of. And if you found value in this message, if something clicked today, go ahead and hit that subscribe button. There's more to come on reclaiming strength, intimacy, and confidence. Let's keep building together. Let's talk about two things most men underestimate, and yet they impact your sexual health more than almost anything else: chronic stress and poor sleep. We often think of testosterone as something fixed, like a battery that just runs out with age. But that's not entirely true. While it's natural for levels to decline over time, your daily habits, especially how you handle stress and how well you sleep, can either protect or sabotage your hormones. Let me share something that shocks most of my patients. If you sleep less than 6 hours a night for just 1 week, your testosterone can drop by as much as 15%. That's not a long-term condition. That's one bad week. Imagine what happens when poor sleep becomes your new normal. And stress? Chronic stress triggers the release of cortisol, a hormone that directly competes with testosterone. High cortisol drains your libido, dulls your motivation, and even interferes with your ability to get or maintain an erection. Now, the good news is, your body is resilient. With the right care, you can reverse much of this. Here's how to start. Prioritize quality sleep. Aim for 7 to 8 hours of uninterrupted rest each night. Turn off screens at least 30 minutes before bed. Try a simple breathing technique. Inhale for 4 counts, hold for 4, exhale for 4. This calms your nervous system. Manage stress proactively. Daily movement is one of the best natural stress relievers. Even a short walk or light stretching can lower cortisol. Talk to someone you trust. Emotional connection isn't a luxury, it's medicine. Practice mindfulness or light meditation. You don't need to sit cross-legged for an hour. Just 5 quiet minutes can shift your brain chemistry. This isn't about being perfect. It's about choosing one small change today that helps your body rebuild its natural balance. Better sleep and lower stress don't just give you more energy. They unlock the chemistry of desire, strength, and confidence. And if this message resonates with you, if you're ready to take back control, hit that subscribe button. We're not done yet. There's still more to uncover. In this journey of restoring real vitality, let's keep going, together. Let's talk about something so simple, it might seem silly at first: sleeping without underwear. But before you brush this off, let me explain why this small nightly choice can have a surprisingly powerful impact on your sexual health, especially as you get older. During sleep, your body goes into repair mode. For men, that includes nighttime erections. Yes, even in your 60s, 70s, and beyond, these spontaneous erections are completely normal and serve an important purpose. They keep blood circulating through the erectile tissue, delivering oxygen and maintaining elasticity. But here's the problem. When you wear tight underwear, especially briefs or snug sleepwear, you may be compressing your penis during these crucial nighttime erections without even knowing it. Over time, that pressure can reduce blood flow, irritate the tissue, and even contribute to the formation of scar tissue beneath the surface. That scarring, left unchecked, can eventually lead to Peyronie's disease, a condition where the penis becomes curved, painful, and difficult to use during intimacy. I've had patients come in confused and frustrated, wondering why they're suddenly experiencing pain or changes in shape, never realizing that something as innocent as tight pajamas could be part of the cause. Here's the simple fix. Sleep naked or wear loose-fitting boxers. That's it. No pills. No devices. Just a little extra room to allow your body to do what it was designed to do while you rest. Not only does this reduce pressure and friction, it also helps regulate temperature, which is essential for both hormonal balance and testicular health. Your body wasn't made to be wrapped tight all night. Give it space. Give it freedom. Now I know this might feel like a strange suggestion if you're used to wearing something to bed. But try it for a few nights. Notice how your body feels. You might be surprised. Sometimes, the biggest changes in our health come from the smallest shifts in habit. And if this idea helped shift your thinking, or even just made you curious, hit that subscribe button. You're just one habit away from better comfort, better circulation, and better long-term sexual health. We're almost at the end. But trust me, the best part is still coming. Let's finish strong, together. If you've made it this far, I want to pause and say thank you, not just for watching, but for choosing to care. Because when you care about your health, especially your sexual health, at this stage in life, you're doing something truly powerful. You're reclaiming your dignity. Too often, men over 60 are told to quietly accept decline, to give up on pleasure, to settle for disconnection. But here's the truth. Your body isn't giving up on you. It's waiting for you to show up for it. And what we've talked about in this series, none of it was about chasing youth. It was about honoring the man you are now. Let's recap for a moment. We started by waking up to the fact that, yes, your penis ages, just like your heart and brain. We talked about staying active, not just sexually, but mentally and emotionally. We covered hygiene, safety during intimacy, reducing porn to rebuild real connection. We showed you how lifestyle trumps pills, how to strengthen hidden muscles, and how managing stress and sleep revives your hormones. Finally, we ended with a simple but powerful reminder. Give your body the space to heal, even while you sleep. Each of these steps might seem small on its own, but together, they form a foundation, a way of living with more presence, more purpose, and more pride. I've been privileged to work with men who thought they were too far gone. Men who were embarrassed, discouraged, or disconnected from their own sense of masculinity. But over time, as they made these small changes, something shifted. They stood taller, they smiled more, they reconnected with themselves, with their partners, and with life. You don't need to be perfect. You just need to be present. Because every decision you make to care for yourself, no matter how small, is an act of self-respect, and that respect is contagious. It shows up in how you walk, how you love, how you lead. So if this series has reminded you of your worth, of your strength, of your right to feel alive, don't stop here. Share it. With a friend, a son, a brother. Hit subscribe so you don't miss what comes next. Because aging doesn't mean disappearing. It means evolving with dignity, strength, and connection. Let's keep moving forward together.